A warm, sunny day in Florida. This is where Stan and Judy Ikenberry like to spend their winters. The rest of the year is in State College.
Well, we're snowbirds, so it's attractive to retreat to warmer weather during the wintertime.
I like the warm weather and being able to be outside and be active.
It's about 70 degrees and very light breeze and broken clouds and sunshine. So yeah, nothing to complain about.
Stan doesn't have a care in the world as he takes a stroll on the beach.
We have a 8-year-old poodle dog, and I spend a lot of time walking the dog both on the beach and off the beach.
At 85 years old, Stan is in good shape thanks to his appointments with his cardiologist.
Why did you start seeing a cardiologist?
I had a high cholesterol level that we needed to monitor. I had a diagnosed mild, not severe, but I had diagnosed heart disease.
Stan sees his cardiologist twice a year.
I didn't have any particular symptoms of any carotid artery issue, but my cardiologist had been following that for some time and realized that the amount of blockage had elevated. So I was I'd gone from maybe 65% blockage to roughly 90% blockage.
Stan was referred to Penn State Health.
After seeing that his degree of carotid narrowing was getting worse over the course of past few years, and he is in a reasonably good shape physically. So given overall the risk-benefit ratio, we deemed him appropriate for a surgical intervention.
After a very brief meeting with Dr. Aziz, I had a very high level of confidence and comfort with him. He did a great job of explaining what the surgery would be and how the surgery would go.
The most recent form of operation is something which we call transcarotid artery stenting, or TCAR, in which we make an incision in the neck to expose the carotid artery and put the carotid stent in the carotid artery. The procedure itself takes anywhere between 2 to 4 hours. We were able to remove the blockage completely, and we were able to get an ultrasound on table at the completion of the surgery to document and to see that the blockage which was visible on the ultrasound before surgery was in fact completely removed after the operation.
During the surgery, it was as he had expected, that it needed to be done, and that he was confident that Stanley would do well in the recovery.
It was a very quick operation in the sense that the operation was done on one day. I stayed overnight and then was able to go home the next day.
Within 10 days, Stan felt back to normal.
He has a very pleasant life. He's able to do about what he wants to do, and he walks a lot.
I feel comfortable and confident that, I'm functioning the way I should, and am able to live a normal life. And that really is the ultimate goal, I guess, that we all have.